Join me as I walk you through my hand filler technique. So as we age, our extensor tendons, which are kind of those bulgy lines that we start to see as we age because we lose collagen, elastin in our skin starts to thin out. We have cumulative exposure to UV radiation over time, and our hands really begin to show our age because they start to look a little skeletal. So what I like to do is use a little bit of dilute Radiesse to not only help volumize that skeletal appearance or soften that skeletal appearance, but also give that biostimulatory effect with that collagen, elastin, proteoglycans, all the benefits that you get from Radiesse. So here I usually mix Radiesse with 0.5 of diluent. So a 1.5 cc syringe of Radiesse mixed with 0.5 of diluent, whether it's bacteriostatic normal saline or sterile water or lidocaine, whatever your choice is. I love a 25 by 2 inch cannula, and I always start with a little poke of lidocaine like you see right here, and then I make my little port site. This is a 23 gauge port or needle, and then I insert my 25 by 2 inch cannula. You want to stay superficial so you could see the shape of my needle. You don't want to dive in deep because you'll hit the muscle. This is a very, very comfortable treatment. Patients state that they have literally little to no pain, if any pain whatsoever. Now, when you're working in the hands, you want to be very mindful of all the veins in the hands, because if you hit those, they're going to have a massive hematoma, and ultimately their results will be the same, but their healing is going to be a little bit dragged out. So inserting that cannula, laying nice retrograde threads in between those tendons to really soften the appearance. That was a distal approach. This is a proximal approach. What I like about this approach is I use one port site to access the entire hand, but sometimes I prefer the other way, depending on the vessels in the hand that I need to avoid. So for her, I'm using the same dilution, but I accessed from the proximal end of her hand. And I'm laying those retrograde threads in between those tendons to really soften the appearance of it. For her hand, you could see how fragile those veins are. So I'm really mindful. If I hit resistance, I'm just knocking on that door and letting the vein kind of move out of my way, and then working my way through. I'm never forcibly pushing that cannula, or you will experience a significant hematoma. So for this patient, we did one syringe per side or per hand. For the previous patient with the distal approach, we only did a half syringe per side because she was on a little bit of a budget. But my preference is one syringe per side. Now, I always tell them that they're going to have some swelling with this. So I always tell them and kind of warn them, don't love the swelling because it's going to go down a little bit and settle, because I did add a little bit of liquid in there. So her end results will be a slightly softer version of what she leaves with. But for her, I definitely would highly recommend one syringe per hand versus a half and a half. But I love this treatment. You get instant results. What I like to do, you can see it's already softening up so much. I'm really taking my time with her hand. What I do after I've injected the entire syringe is I will then wrap a drape over her hand, and I have them, I kid you not, sit on their hand. So I'll put her hand underneath her thigh, and this helps kind of restrict the swelling and kind of blend the product into the hand. And I love this little pro tip. While I'm working on her other hand, she'll sit on that hand, and then I'll have her sit on both hands for about a minute. But I really spend time massaging that product in. So now, topping off this beautiful patient, remember this is the distal approach. You see how I'm fighting a little bit of resistance. When that happens, I really kind of reorient my cannula, and I never forcibly push that cannula through. So results last, I typically say about 9 months. Typically patients don't get a full year because they're constantly using their hands. I will say they'll be a little tender in this area for a few days, but otherwise zero downtime. I massage that filler, and you could see how beautifully that filler integrates so nicely. Look at that before and after photo. She was absolutely thrilled. She's a little salsa dancer, so she's really excited to show off her new hands.